everyone, the name is Dr. Benfrimpong, and welcome once again to the TutorMed channel, where medicine is simplified. Today's video promises to be exciting as we will take a look at the overview of the arterial blood supply of the entire body. At the end of today's video, we will have a clear mental picture of how the various organs of the body get their blood supply and appreciate some anatomical concepts. Kindly take a few seconds to like and share this video. Subscribe to our channel if you love what we do. This means a lot to us, and thank you for doing just that. Very good. And so we will begin our discussion with this organ, the heart. Now some orientation here. This is the left ventricle, and the vessel here coming out of the left ventricle is the aorta. Then we have the right ventricle, and this vessel here is the pulmonary trunk or the pulmonary artery. Now many of us are aware that blood vessels which carry blood away from the heart are called arteries. And so the aorta carries oxygen-rich blood from the left ventricle to systemic tissues like the heart muscles, head and neck structures, the upper limb, the lower limb, abdominal structures. All these are systemic tissues. While the pulmonary artery carries oxygen-poor blood, otherwise known as deoxygenated blood, from the right ventricle to the alveoli of the lungs. They represent the pulmonary tissues. And so first, let's see how the entire body gets its blood supply from this single vessel, the aorta. So we are looking at the systemic arterial blood supply. Well folks, let's follow the course of the aorta a bit on this slide. The aorta begins as a root, and so that is the root of the aorta. Then it continues as the ascending aorta, then the arch or the arc of the aorta, the descending aorta, and then continues down as the thoracic aorta. Now a little above the root of the aorta, the first branches that come out are the coronary arteries, the arteries that supply the myocardium of the heart. It means the heart thinks it's wise to supply itself before the rest of the body. But as you would learn later, the heart gets its blood supply during diastole or during relaxation. And so we have the right coronary artery and the left coronary artery. Then on the arch or the arc of the aorta, three separate large branches come out. The first is on the right and is called the brachiocephalic trunk. The next is the left common carotid artery. And then the last branch is the left subclavian artery. Now unfortunately in this model, it appears as though the left common carotid artery arises from the brachiocephalic trunk, but please, this is not correct, because it usually arises from the arc or the arch of the aorta directly. Now what are these three branches going to do? They are going to principally supply the head and neck structures and the structures of the upper limb. The term brachiocephalic comes from two root words, brachium, which means arm, and cephalic, which means towards the head or towards the proximal structures. It means this artery will further divide into an artery which is going to the head and another which will go to the arm. And as you can see, the one going to the arm will be called the subclavian artery, and this one is on the right, and so the right subclavian artery. Then the one going towards the head region will be called the common carotid artery, and it's on the right, and so the right common carotid artery. So you see, we have the right and left common carotid arteries which feed the head and neck structures on the right and left side respectively. And then the right and left subclavian arteries, which principally supply the right and left arm respectively. I used principally here because the subclavian artery feeds other parts of the body apart from the arm, and we will look at that later. The term subclavian means that the artery runs under the clavicles, and the term carotid actually comes from the French word carotide, which means drowsiness, used to describe the artery going to the head to indicate that when that artery is occluded, the person will feel drowsy. That is why the artery going to the head and neck is described as carotid artery. Good. And so, still following the course of the aorta, let's use this model which tells us how the aorta begins as a root and then ends at a point the aorta bifurcates, as you can see. And here in this model, you can see the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery, the three main branches on the arch of the aorta. And as you can see here, the left common carotid artery correctly has been positioned in such a way that it arises directly from the arch of the aorta, and then it continues as the descending aorta, then it continues in the thorax as the thoracic aorta. Then at the level of T12 or the 12th thoracic vertebrae, the thoracic aorta penetrates the diaphragm and then enters the abdominal cavity as the abdominal aorta. Then again, at the level of L4 or at the level of the 4th lumbar vertebrae, the abdominal aorta bifurcates into the right and left common iliac arteries. Now, to make things easy for us in determining the blood supply of the various parts of the body, we need to learn the arterial blood supply based on the regions or the various regions of the body. Now, anatomically, the body can be divided into various regions, and this drawing will help us in the various divisions. And so, in the cephalic part, we have the head and neck region. Then we have the chest or the thorax, and then we have the upper limb or the upper limbs. Then we have the abdomen, which is followed by the pelvis, then the perineum, then we have the lower limbs. And so the first region of the body you want to study its blood supply are the upper limbs. And so this picture would help us do that. This picture shows the blood supply of the right upper limb, but kindly take note that the same occurs on the left upper limb. And so here you can see the aorta, and you can see the three main branches at the arch of the aorta: the brachiocephalic trunk, the left common carotid, and the left subclavian. But here I'm going to indicate the right subclavian and then the left subclavian, so the subclavian arteries. Now let's follow the right subclavian down its course. Remember that subclavian means it passes under the clavicle. So it passes under the clavicle into the armpit. The beginning of the point it exits under the clavicle, the subclavian changes to be the axillary artery. Then the axillary artery goes on the same artery. Once it crosses the teres major muscle, which is not so important to keep in mind, it becomes the brachial artery. And so the point I want to make here is that the subclavian artery becomes the axillary artery, and which also becomes the brachial artery, the same artery, but their name changes depending on the point they are found at. Then the brachial artery will divide into the radial artery as labeled and the ulnar artery. Then in the palm, the radial artery and the ulnar arteries would anastomose to form the dorsal or the arterial arch, as you can see. And so if you are asked, can you tell us how blood gets to the hand? You would say that the left ventricle pumps blood through the aorta, and then the subclavian artery takes the blood to the arms through the axillary artery, the brachial artery, and then the radial and ulnar arteries. Very good. And so folks, if you like what we are doing so far, kindly support the channel by liking and sharing this video, and then subscribe to our channel. Hit your notification bell so that you'll be notified when we release more simplified videos like this. Now, the next region we want to focus on is the head and neck, and this picture or this model will help us in that regard. Now, some orientation here. This is showing the right side of the head, and so you can see the brachiocephalic trunk here, and then the right subclavian artery. Before I talk about the arterial supply of the carotid system, notice that I said that the subclavian artery, apart from supplying the upper arm, also gives supply to other regions of the body. Notice the branch that is coming from the subclavian artery here. That is the vertebral artery. You see it ascending up into the head. And this vertebral artery, together with the internal carotid artery, as we will see in later videos, supply the brain. The vertebral artery forms the posterior circulation of the brain. Now, this is the right common carotid artery. Now, in anatomy, anytime that you hear that a vessel is a common vessel, it means that that vessel will eventually divide into an internal and then an external branch. And so in that regard, the right common carotid artery will divide into the right internal carotid and the right external carotid. Now, the common carotid artery feeds structures of the neck and then the brain. So structures of the neck like the thyroid, like the trachea, etc. Now, the internal carotid artery feeds structures within the skull, whilst the external carotid feeds structures in the head which are outside of the skull. And so the point here is that the carotid system supplies the head and neck structures. And so the next region is the chest or the thorax. Let's see the blood supply in this region. Just an overview. Now, to do that, we need to have a mental picture of the chest in our minds. And so quickly, let's look at how the chest is. From the back, we have the 12 thoracic vertebrae forming the thoracic spine. And this is followed by the esophagus. Although somewhere along its course, the aorta is actually the most posterior structure. Then in front of it, we have the trachea. And then we have the heart, and then the great vessels, where we have the aorta, and then the superior and inferior vena cava. The heart also has got its pericardium. Then we have the right lung, and then the left lung. Then this is covered by the thoracic cage with the intercostal muscles. Then in front of this, we have the muscles of the chest, particularly the pectoralis minor and pectoralis major muscles. Then this is covered by the skin of the chest. And so this is how the chest looks like mentally. We have the picture. Now let's see which artery supplies these structures and what are the general principles. know the structures of the chest, including the visceral organs in the thoracic cavity, it is important to note that the visceral organs and then the posterior chest wall is supplied by the thoracic aorta. And so this diagram will help us understand this. And so here we see the heart, which is bounded behind by the thoracic aorta. And so the general principle is that the thoracic aorta supplies everything in the chest cavity plus the posterior chest wall except the alveoli and the heart muscles. We know, or from the very beginning we've given a hint on what supplies the alveoli and the heart muscles. The alveoli are supplied by the pulmonary artery and then the heart muscles by the coronary arteries. And so the thoracic aorta gives the posterior intercostal arteries, as you can see shown in the diagram I have given. Okay, and then it gives off bronchial branches. So the bronchial branches supply the bronchial tracts, or the bronchus, or the bronchi I should say. Then supplies the parietal pleura and sometimes the visceral pleura. Then it gives esophageal branches, because remember we are supplying everything in the chest cavity. So there is esophagus in the chest cavity, and so they get their blood supply from the thoracic aorta as it journeys down the diaphragm. What other structure is in the chest cavity? The pericardium. And so the thoracic aorta gives pericardial branches to the pericardium, and then it also gives other mediastinal branches to other organs. And so the branches of the thoracic aorta may be remembered by the acronym POMB. P for pericardial branches, O for esophageal branches, M for mediastinal branches, B for bronchial branches, and then I for the posterior intercostal branches. Well folks, so on this slide I got a picture which clearly shows the descending thoracic aorta with some of its branches. So here you can see the aorta lying just in front of the thoracic vertebrae or the thoracic spine, and we can see the bronchial vessels or the bronchial arteries like I mentioned, then esophageal branches. Then you can see some of the posterior intercostal arteries, which are also branches of the thoracic aorta. Of course, we have the pericardial branches and we have other mediastinal branches. And so this is just to reinforce the picture we saw earlier. And so kindly remember that we said the thoracic aorta continues into the abdominal cavity as the abdominal aorta. And so this aorta in the abdomen is going to supply the structures within the abdomen. And so just like we saw in the chest, we need to see how the contents of the abdomen are arranged so that we can have a mental picture of the structures the abdominal aorta is going to supply. And so beginning from the back, we have the posterior abdominal wall, which is formed by the lumbar vertebrae, and then the lower parts of the thoracic vertebrae and then the lumbar vertebrae. And you can see the posterior abdominal wall muscles. You have the iliopsoas muscle, the quadratus lumborum muscles, and then we know that the most posterior structure is the abdominal aorta, the structure which is going to do the supply. And then we have from there we have the kidneys and then the ureters. Then I'm going to put the spleen in the left hypochondriac region, and then I'm going to follow this by the pancreas, and then some bit of the gallbladder. Forgive me for these isolated pictures, but I just got them to make sense of what I'm doing. And then from there we have the stomach. Then I'm going to place the liver here, then the small intestines, the large intestines, and then we are going to treat this patient as a woman, and so we are going to put the uterus in front of the rectum here, and then the urinary bladder. Then this structure is covered by the anterior abdominal wall, and so we have an idea of which structures are found in the abdomen. And then we know that the most predominant system found in the abdominal cavity is the gastrointestinal system. And so we need to know which branches from the abdominal aorta supplies the gastrointestinal system. Now, from embryology, the gastrointestinal system is divided into the foregut, the midgut, and then the hindgut. And so we want to look at the foregut and its derivatives. So as far as the abdominal contents are concerned, the foregut of the gastrointestinal system begins from the abdominal esophagus. There is a part of the esophagus which enters the abdomen, and so from the abdominal esophagus to the second part of the duodenum. That is what makes up the foregut. And so we have the abdominal esophagus, the stomach, the first part of the duodenum, and the second part of the duodenum. Then we have the derivatives of the foregut, which are the liver, the gallbladder, the spleen, and then the pancreas. Now, why did I go through all these? Because it's a general principle that the foregut and its derivatives are supplied by a branch of the abdominal aorta known as the celiac trunk. And so if you are looking for the blood supply of the pancreas, it is from the celiac trunk. If you are looking for the blood supply of the liver, it is from the celiac trunk. Blood supply of the spleen, which is the splenic artery, it is from the celiac trunk, which is a branch of the abdominal aorta. And so still on the gastrointestinal system, we are done with the foregut. And so we come to the midgut. And so the midgut, remember the foregut ended at the second part of the duodenum. And so the midgut will begin from the third part of the duodenum to the proximal 2/3 of the transverse colon. What this means is that the midgut would begin from the third part of the duodenum, then will continue as the fourth part of the duodenum, then it will come to the jejunum, ileum, the cecum and the appendix, the ascending colon, before it gets to the proximal 2/3 of the transverse colon where it ends. Now, the midgut is supplied by the superior mesenteric artery, which is also a branch of the abdominal aorta. Then we have the hindgut. The hindgut is seen from the distal 1/3 of the transverse colon to the anus, and this is supplied by the inferior mesenteric artery, which is also a branch of the abdominal aorta. And so by looking at these principles, we have identified 3 abdominal aortic branches: the celiac trunk, the superior mesenteric artery, and then the inferior mesenteric artery. Then, of course, apart from the gastrointestinal system, we have the renal system. And so since the kidneys are there, we know that the renal artery supplies the kidney with oxygenated blood. And so we have identified the renal artery as one of the branches of the abdominal aorta. Then we have a gland which sits on top of the kidney called the adrenal gland or the suprarenal gland, and that is supplied by the suprarenal artery. Remember, we are just doing an overview, just to get an overview of how the blood supply of the body is. Okay, then we have the lumbar branches. The lumbar branches feed the posterior abdominal wall. Then we have the gonadal arteries, the arteries which supply the gonads. So if it's a male, we are dealing with the testicular artery, and if it's a female, we are dealing with the ovarian artery. And so these are the few branches of the abdominal aorta. And so contents, or the rest of the contents, the structures are found in the pelvis, like the uterus, the female uterus, like the ovary, but the ovary, I'm saying, gets the blood supply from the abdominal aorta. The urinary bladder is also a pelvic organ, and so it will get its blood supply from the internal iliac artery. We will look at that shortly, but please get these principles: 5 main branches of the abdominal aorta. Very good. Now we are getting into the pelvis, but remember that we said at the level of L4 the abdominal aorta will bifurcate, and so this diagram will show us that. You can see that the abdominal aorta bifurcates at the level of L4 into the common iliac arteries on the right and then on the left. And the common iliac artery, remember that I said that anytime a vessel has the name common, it means that it is going to divide into an internal branch and an external branch. And so at the sacroiliac joints, the common iliac arteries would divide into the internal iliac artery and then the external iliac artery. So the internal iliac artery would feed the organs of the pelvis and then the perineum, whilst the external iliac artery would continue as the femoral artery, which would feed the structures of the lower limbs. Very good. And so, like I said, we are going to talk about the pelvis and then the perineum. And I said that this is supplied by the internal iliac artery. I'm not going to go into details for this region, but I just want to reiterate or hammer on the point that the internal iliac artery is one of the branches of the common iliac artery, and then it supplies the pelvic organs. Okay, so like the uterus, so the uterine artery would be from the internal iliac artery, like the urinary bladder and other pelvic structures. Then it will also supply the structures of the perineum. So this diagram shows this very well. You can see the internal iliac artery with its various branches supplying the various organs in the pelvic cavity as well as the perineum. Very good. And so the last region we want to look at are the lower limbs. So the lower limbs, we are talking about the thigh downwards, the knee, the leg, and then the foot, or the feet, if you will. Now remember that we said that at the sacroiliac joint, the common iliac artery will divide into the internal iliac artery and then the external iliac artery. Now the external iliac artery, once it crosses under the inguinal ligament, it becomes the femoral artery. And so let's show a picture, or this is a picture of the lower limbs. You can see that the femoral artery is a direct continuation of the external iliac artery. Then somewhere in the upper part of the thigh, close to the neck of the femur or the thigh bone, it would give some branches called the profunda artery, but the main artery is the femoral artery. And so kindly take note that the femoral artery is just a direct continuation of the external iliac artery. It will course down to divide into two main arteries in the popliteal region. Let's see that in the next slide. Very good. And so once the femoral artery gets into the popliteal fossa, once it gets into the popliteal fossa, it divides into the posterior tibial artery, and then, once it gets into the popliteal fossa, it becomes the popliteal artery, which quickly divides into the posterior tibial artery as labeled, and then the anterior tibial artery. So this is like the radius and then the ulnar equivalent in the upper limb. So the anterior tibial artery would continue and become the dorsalis pedis artery. Then the posterior tibial artery would continue downwards, but will give a branch called the peroneal artery. And so this is how the arterial supply of the lower limb is like. Now remember that the circulation we have dealt with is actually the systemic circulation, and so we have given an overview of how the systemic tissues are supplied with blood. Now let's go to the pulmonary tissues, and we are talking about the alveoli. And so I put the hat here again, and I give an orientation that this is the right ventricle, and then the right ventricle pumps through the pulmonary trunk or the pulmonary artery into the alveoli. Why? Because we need to pump that blood into the alveoli for its gaseous exchange, so that the blood can be oxygenated. And so this is a picture showing the pulmonary artery going straight into the alveoli to give them deoxygenated blood. And after the blood has been oxygenated, they go through the pulmonary veins, which are in red. Pulmonary artery is in blue because of the deoxygenated blood. Then the pulmonary veins will send the oxygenated blood to the left side of the heart, and then the left side of the heart will pump that oxygenated blood through the aorta, and then the blood would feed, or the aorta would feed oxygenated blood to the tissues I have discussed earlier on. And so, my friends, having the general overview of how each organ supplies, gets its blood supply, we should be able to tell the pathway the blood goes through before the particular organ gets its blood supply. For example, if we are asked to describe how the placenta gets its blood supply during pregnancy, the fetus within the womb, how does it get its blood supply from the mother? Then we know that it is from the left ventricle first. Then the blood will go through, from the left ventricle, the blood will go through the root of the aorta, pass through the ascending aorta, the arch of the aorta, and then descending aorta. And from there, the next place it would move to is the thoracic aorta. After the blood has crossed the thoracic aorta, it will enter the abdominal aorta. Remember that the uterus is a pelvic organ, and so it would get its blood supply as a pelvic organ. So from the abdominal aorta, the blood will move to the right and left common iliac artery, and then it will move into the right and left internal iliac artery. That is where the uterine arteries would come from. Then from the uterine arteries, the blood will get into the placenta bed. And so we should be able to describe how blood courses through the various pathways before it gets to a particular organ. And this is just an example. And so thank you for watching this episode of TutorMed. Please do not forget to like and share this video and subscribe to our channel if you have not done that yet. See you in our next video, and until then, adios. Bye.